My name is Christelle Ilboudo, and I am a pediatric infectious disease physician here at MU Healthcare.
Could you just update our listeners and viewers on the situation with the coronavirus as deals with MU Healthcare?
So, as far as I know, we have not had any cases here at MU Healthcare. Of course, that's a situation that's changing hourly. I know we've had our 6th case reported in Missouri so far. Not yet sure of the exact location of that individual.
And have you done any testing at MU Healthcare?
Yes, we've done quite a few testing through the state health lab.
And do you have a number on how many you've tested here at MU?
Not in details. The health department has that information available.
What about tests themselves? When do you expect tests to come into MU Healthcare, and how many are you expecting?
So we prioritize testing through the state health department. We are working on collaboration with some commercial labs as well, so that we can maximize our capacity for testing.
But do you know when the actual test kits are coming and how many are coming?
I am not sure of the details of when they're coming, but it should be sometime this week.
And who will have access to these tests?
So we will still have to prioritize and triage. Again, remembering that whether we use the health department or these commercial labs, that they have a certain capacity for testing. And so our goal would be to prioritize those that are at high risk and those that are very sick in terms of testing. We actually recommend for people who think they could have it and have mild symptoms to stay home or call their physicians for advice on what to do next.
So there are drive-through testing locations that have been set up in some communities in Missouri. Do you anticipate there will be drive-through testing at any point at MU Health?
Yes, I anticipate that we'll be setting those up as well. Again, with the goal of speeding triage, really trying to save our emergency department for those patients that really need urgent and critical care. So yes, we are in the process of setting up a similar setup for testing.
Do you have an idea of when that would be available for the community?
No, I know that the administrators are working really hard at setting those up, and that they will come out with a statement in a day or two once those plans are a little clearer and put in place.
What's your opinion of the decisions by some school districts? Harrisburg schools here in Boone County are closed today. Columbia Public Schools is planning to close. They'll have more information today. What do you think of the decisions by those districts to close, and should other school districts follow suit?
I think, what the CDC recommends, that it really should be a case-by-case determination. Right now, we don't have evidence of local transmission in our community, meaning that we're seeing an increased number in cases or cases not related to travel. But when that happens, we will really be relying on the health department to make that determination. The closing of the higher education, the universities, makes sense to me because of social distancing. Again, realizing that those students come from all across the nation and the world and may have been exposed unknowingly while they're traveling. And so that decision goes in line with what we would recommend in terms of social distancing to decrease the spread.
So going back to testing for a second, are you seeing a lot of people asking to be tested that don't even have symptoms right now? Like, is that becoming more prevalent?
I haven't heard or haven't seen that. Again, I am not in a primary care clinic, and so I don't know that I'm the most qualified to answer that question. But what we are recommending is, if people have questions about whether or not they should get tested, the health department actually has a 1-800 number they can call just to ask questions about the coronavirus and what they should do. If they think that they have exposure or symptoms, we do now have the ability to do MU Health visits for that. And so if they go to muhealth.org/coronavirus, they can find out more information about that, and we can screen them that way. Other people can call the physicians or the providers and ask for guidance as to when would it be appropriate for them to seek care.
And do you know if MU Healthcare is starting to put together any quarantine locations? We've heard some reports that there may be a quarantine location at like a dorm on Mizzou's campus. Are you prepping for any quarantine centers, or is that are you looking at making that happen?
So quarantine decisions are made by the health department. we cannot mandate people stay home. And so we rely on the guidance of the health department to do that. As far as the setup or the structure, again, it will be a health department decision. What we do recommend is self-isolation, which is different than quarantine is. If somebody think they've traveled or have exposure, to see how they can stay home, avoid crowded area, especially if they have symptoms of cold symptoms, and then calling the primary care provider to figure out whether they fall in the testing category or not.
As the number of confirmed cases grows, what is MU Healthcare doing to prepare for an onslaught or a rush of patients?
So we have very robust plans in place. As I mentioned earlier, one of our administrators will make announcements on that plan, on those plans to the public in a day or two. But there's a lot of work in preparation in our system to prepare for seeing more cases or more patients.
So you have no details at this time?
No details that I can share publicly yet.
So do you know how many ICU beds are available at MU Healthcare and how many more you could add in case of potential emergency?
Again, that's a question that I would defer to the administrators. I think that we are working on maximizing our capacity and seeing how we can potentially cohort patients if we see a large number. But again, those are details that would come from our administration.
So the number of cases in the United States yesterday, as tracked by Johns Hopkins, grew by 1,200. That's about a 50% increase in the number of confirmed cases in the United States in a single day. Is this at all under control, in your opinion?
So I think if we look at projections from other countries, that we have yet to hit that bell curve or see the worst of it, and so this is why really social distancing becomes critical, especially for community like ours who do not have a lot of cases yet. And particularly focusing on those people who are healthy, may just have mild cold symptoms, or could have traveled to one of those areas recently, that this is really the time to look out for individuals in our communities who are high risk. And again, those people are the elderly, people with chronic conditions, heart disease, lung disease, diabetes, or whose immune systems are compromised.
And are you doing anything to limit at MU Healthcare, like limit employees or steps to protect nurses from contracting the virus? What are things in place to protect your employees or your nurses if there were the coronavirus to come to MU Healthcare?
So we do have robust infection control plans in place that we always have had. And so we have those procedures and policies in place for our healthcare workers if they would be taking care of those patients. And we also have plans in place for what we would do if they have to stay home. And again, the details of that information is something that will come from administrators, but we do have a very strong plans in place that we've had for a long time.
Doctor, what overall advice do you have for the public on today, Monday, where we stand at this time with the coronavirus?
I think that people should prepare, meaning get ready for the eventuality of having to be quarantined by the health department or being more aggressive with self-isolation. And so for people who have chronic illnesses, now is the time to make sure they have all the medical supplies, that they're ready to stay home if they must. And again, those people are the elderly, people with any chronic medical condition should be prepared for that eventuality. And I think we just have to work as a community. There's a lot of panic, there's a lot of fear, but again, relying on good sources of information and following closely guidance that is coming from our health departments.
So how do you guys deal with community anxiety a little bit, and how can people deal with anxiety stemming from coronavirus fears?
That is a very good question. I think for people who have anxiety on a medical level, talking to the providers would be my best advice. And for other people, it's just, again, when people are prepared, they have less anxiety. And we know that it's an ever-changing situation and it's a new virus, so we don't completely understand it yet. But I think as time goes on, we'll learn more and more about it. And we do have to keep in mind that 80% of people who get infected do better or get over it. And the majority of them don't even need to come and see a doctor. And so I just recommend that people really check sources for getting the right information and just be prepared.
So what should viewers know as they see more and more places closed due to a health standpoint? So what should people know as more and more businesses, events, places close from a health standpoint?
I think those would be good decisions if we get to the point where we're closing restaurants or bars or things like that that they've done in New York. I think those would be good decisions if we have to go that route. And again, people should be prepared for that eventuality. I don't know that we are yet at that point to take such drastic measures in our community, but we could be in a day or in a week.
And why is that? Why is social distancing so important? Like limiting groups of people to 50 and closing restaurants. Like why does that help in this kind of situation?
So for people who have mild symptoms, a cough or a sore throat, and do not yet have the fevers or the more worrisome symptoms of COVID-19, they can still spread the virus. And when you live in a community where there's a lot of traveling, so people have come and gone from different places, that there's a higher chance that they could be infected and pass it on easy and introduce it in other communities. So that's why social distancing really helps and works. Again, especially for people who have mild symptoms, cold symptoms, to try as much as possible to stay out of crowds. And people, again, that we know get the worst disease, so older people should really avoid crowded environment and places.
What did you personally do over the weekend that you wouldn't have done previously, or what did you not do that you were planning to do over the weekend?
So personally, I went grocery shopping. I bought some food ready for my kids. I made sure that all of our medications were not expired, made sure we have anti-fever medication in our house, just in case, and preparing again my children. We went through hand hygiene, how to wash your hands, how frequently you should wash your hands, and just preparing them for the eventuality that we might come to a time where we would need to all stay at home.
Were there any activities that you had planned for the weekend that ended up being canceled, or that you personally didn't take your family to because of the what you're telling us today about social distancing?
So not just for COVID-19, but in influenza season, I've always been more cautious. As a matter of fact, my twins' birthday is in January, and we don't have birthday parties for that reason, because again, it's high flu season. And so personally, I haven't changed any of the things that we would do, being cautious about going to crowded places, going to recreational parks or indoor places that have a lot of children when we see in these cases. And I haven't personally changed that, because that's something that I would do in respiratory season anyways.
You talked about finding the right sources of information. How do you think the media's done in terms of covering coronavirus thus far?
I think for the most part, because information is so fluid and changing, that it is really hard to keep up and know what's the latest. But I think really relying on the numbers and things that we are seeing, and avoiding situations where there is a fear that is being used, and things like that. So I would rely on the information that's coming from our public health, and again, trusting that the steps that they're recommending we take is based on what they know at that time, and those can change anytime. And so my recommendation is, again, checking those new sources that have the right information, knowing that this is information that could change tomorrow or in a week.
And for tips for journalists, what would you give them in terms of getting the accurate or covering or getting the right information to cover?
I think just like you're doing, talking to the experts, talking to the health department about the steps that are in place and what we're doing, and really to talking about what people should do at home. I think those are great things that we can do to prepare ourselves.
So with social distancing, is MU Health limiting hospital visitors, or are there any other new protocols that you guys are putting in place in the hospital with social distancing?
So we already have visitor policies in place that are applied. We do have signs for people, if they're coughing, not to come and visit or to wear a mask. Again, as the situation changes and progresses, once we start seeing cases here, then we will escalate up our visitor policies and limiting that. So we do have those, again, as I mentioned, we have those plans in place. And it would be up to the administrators to decide at what point do we trigger those more stringent restrictions.
So you said